if I were to say a ballpark, probably in 25 to 30% of patients, we see a suboptimal response. In other words, their hemoglobin is still low.
The first treatment started in October or early November of 2021, and so this was January 2023, so just over a year. I was having more time between blood work because things had been maintaining. I think getting blood work just once a month maybe. And so I got blood work and my hemoglobin was at 83. So that wasn't too much of a drastic change, but it was still lower.
A lot of us really don't appreciate how significant modest anemia can be. The lack of mental clarity, that's a really underappreciated symptom. You understand shortness of breath. You can't climb up those stairs without puffing, but not being able to problem solve and multitask, really didn't get that until you see it in front of your eyes. And a transfusion doesn't do it because it doesn't last.
I was getting regular blood transfusions every 3 weeks. My physical symptoms became kind of at the forefront of everything. They were the only thing I was paying attention to, the only thing I could pay attention to, because there was just such a drastic change and decline in how I was feeling.
The quality of life is impaired. And if they're being transfused, or their hemoglobin is sitting about 80 or 90, they're chronically tired, then you've got to think about something else to do.
I started to lose, maybe it wasn't losing independence, but a sense of independence. I just couldn't do life how I was. I was really tired again, and getting out of bed was just more and more and more difficult. I couldn't breathe, so I couldn't talk. I couldn't stand upright without passing out. And I was just in a lot of pain. It was just really uncomfortable existing in my body.
The disease is the same, but every patient's different and how it manifests is different. And each patient will have different levels to which they will complain about particular symptoms. It's really a matter of balancing what you hear from the patient, interpreting that. And the challenge is always saying, how much is this symptom right now that they're experiencing is a symptom of their PNH or a symptom of poorly controlled PNH, and how much would they benefit from that, considering an alternative.